Hi, my name is Dr. Vincent Martin. I'm a professor of medicine at the University of Cincinnati College of Medicine, and I'm also co-director of the Headache and Facial Pain Program in the Gardner Neuroscience Institute at the University of Cincinnati. So I'd like to welcome one of my patients to this interview. Thank you for doing this.
You're very welcome.
All right, so the purpose of this is to kind of talk about your different headache types. So the first headache type I want you to describe are your migraines, because I think you get two different headache types. Is that correct?
Correct.
All right, why don't you describe the location of the headaches, what the quality of pain is, and how they affect you?
Okay. So from a migraine standpoint, they always start as a dull headache around my sinuses because I do have severe allergies, especially to mold, and mold specifically has been high in this Ohio Valley this year. So I've noticed it a lot. I was waking up every morning to, excuse me, to a dull headache. And actually if it starts to move, it'll move around my sinuses and my nose, like we describe as the mask around my sinuses. So I know it's going to become a migraine if I'm going to see more peripheral visuals, I guess. I'll start to see like, what do they call it, the auras or halos or some sort of lights. So that's where I know it's going to be a headache that's even more severe because it's in that area.
So you think that the allergies and sinus problems actually trigger some of your migraines, is that correct?
Absolutely.
And do you get any nasal symptoms with those types of headaches?
Yes, well, I have drippage anyway, so I take a nasal spray every day anyway, regardless if it's high mold or whatever the seasonal allergies say. So I actually take two as well. One that you prescribed that has helped, and then that's pretty much it.
Because actually, just to kind of highlight this, is that it's not uncommon, particularly in our area, which is Cincinnati, for patients to have two different headache types. So they can have both their migraines, and then they'll often refer to their sinus headaches. They usually call them sinus headaches, and they'll put their hands over their forehead. They'll kind of put it over their forehead and also their cheekbones, and they'll say, "But I also have sinus headaches as well." And many people will report that the sinus headaches actually trigger the migraines, and I think that you would attest to that.
Absolutely. Yeah, when I was describing earlier, it just starts as that sinus headache that I think, and then as it gets stronger, I know it's going to turn into a migraine, and that's when I'm taking that medicine to help prevent it become stronger.
Now, when you get what you call your sinus headaches, do you get any sensitivity to light or noise? Does that bother you when you have those types of headaches, or just the migraines? Or
just the migraines, when it gets into full-blown migraines. The sensitivity to light is when I know it's going to become a migraine.
Right. Okay, do you ever get nauseated with the early, the sinus type stuff where you get it in your forehead and cheekbones?
Now I'm going to remember my last one instead of all of them.
That's okay. That's okay.
It just depends. I know, not that I can remember.
Okay. Now you get a lot of nasal congestion, or
Yeah.
you get nasal discharge too?
Yes.
And do you get postnasal drip where you feel like there's drainage down the back
Yes.
of your throat? Okay. And do you get itchy eyes at all with?
This season I have been. I haven't had itchy eyes. I've been taking allergy shots for the last 3 years, but I feel like this allergy season from spring to fall, I've been rubbing my eyes a lot more. And so I think that's what's brought me from the allergist to you as a headache specialist to go from just talking allergies to talking, more what is wrong with these headaches or what is going on with these headaches.
Mm-hmm. And do you think that any treatment for the allergies has helped your headaches?
Yes, but I think this has been a severe season, so I think and I apologize if I'm using the wrong word, but Topamax, I think that has really helped. I've been taking that for a good month now at night, and just that small dose has really taken away that morning dull headache that I've been feeling, so.
I think a lot of different physicians don't really think that allergies and sinus actually trigger headaches, but what happens is they miss this association between these two disorders. In fact, there are studies that suggest that about 60% of patients with migraine actually will have hay fever type symptoms. So they'll have runny nose, they'll have postnasal drip. So there's definitely an association there, and most headache doctors believe that it's just the migraines producing those symptoms, and that the allergies and the other triggers for these symptoms aren't really important. But there has been more recent research to suggest that the treatment with certain therapies for allergies can at least reduce pressure in the sinuses that can occur with hay fever and what we call rhinitis, which is the medical term for what we have, and so forth. So there is some early data to suggest that treatment might actually help both. So another important teaching point is that when you have someone that has both migraines and possibly sinus, is you probably need to treat both disorders, because just treating the sinus stuff is not going to take care of the migraines completely. It might help some, but it's not the whole panacea. So oftentimes, like in yourself, you have to treat both disorders. Like you have to treat both the migraines with a preventative as well as the sinus symptoms. What kind of effect do you think that the allergy symptoms have had on your life?
Well, it's definitely, I'm a weird case because I'm in my early 40s and I didn't get allergies until my early 30s. So I've only had them for about 10 years. So it's definitely made, especially from a breathing standpoint, it's just made everything a little bit harder, from an exercise. I've had to see a pulmonary doctor for asthma, so it just seems very odd. But I would say I would agree with you, especially from the nasal spray, because I've been seeing an allergist here for 3 years, getting allergy shots and being told to take Singulair as well as a nasal spray like fluticasone. But you were the one that gave me the other nasal spray in addition to the daily medicine. So I think I tried the daily nasal spray first for a month and then went on the monthly or the daily headache medicine, Topamax.
Yep.
So I could tell the difference within that month.
Yep.
That things were clearing up better. And at night is when I was noticing it more, that I was going for that nasal spray. That's when I was needing it. So I don't think I answered your question, but there you go.
No, you did. So I think let's talk about the nighttime symptoms. So basically, people always ask, well, how could allergies trigger headaches? And one mechanism is that when you lay down at night, your nostrils engorge. I don't know if you've ever noticed that before,
no.
But and what happens is a lot of times if you've got some nasal congestion from allergies or from hay fever, your nose gets even more congested, and then you become a mouth breather. And when you become a mouth breather, sometimes people are more likely to snore, or some of them have sleep apnea, and then
I do.
And some people will also actually have, if they don't have frank sleep apnea, the snoring will awaken them multiple times at night, so they basically don't get a rested sleep. Consequently, that in itself can trigger headaches as well. In addition, just the inflammation in the nose and in the sinuses can kind of irritate nerves in those areas and kind of create some pressure sensations over your cheekbones and over your forehead and between the eyes. And if you can open those sinuses up with some of these therapies, you can often relieve some of those pressure-like symptoms, which, if they trigger migraines, might, at least theoretically, might decrease the frequency of migraines as well. Now, why don't you talk about your migraines? Like, where are those typically located?
I would say that they like to move from the sinus area and the cheekbone area behind my eyes they'll start to move towards the back of my neck, or back of my head, I should say. But that's when it's severe and I haven't taken the medicine. So that's when I didn't catch it, and when I started coming to you. So.
And how many days per month would you say you get those types of headaches on average now, and how many in the past?
Now I haven't had any since I've been taking the medicine, and before it was at least 1 to 2 times a month.
1 to 2 times per month. And how disabling or what kind of impact did these headaches have on your life?
I couldn't work. I definitely was calling in sick. I was taking that medicine, and I think it was just in the beginning that it would start to give me a stronger headache, but would kind of knock me out, and then I would rest and wake up and feeling better, but just very fatigued. So I really wasn't able to do much during those days.
And did you also get nauseated with your migraines?
Yes, if it was that severe, yes.
Would you vomit too?
I wouldn't. It would just go with the nausea would just come with it.
Okay, and then with the migraines, were you sensitive to light or noise?
Definitely, the noise especially. I feel like the light definitely was more of an indication that it was coming. It was the noise, and I would put like a little iPad over my eyes, but it was the noise that I noticed more, and maybe it was because I covered my eyes.
Now, let me ask you another question. Let's go back to some of your hay fever symptoms. Do any what we call non-allergic triggers cause the symptoms? Like one non-allergic trigger would be cigarette smoke. Can you tolerate cigarette smoke?
No, not at all.
What will happen when you are around cigarette smoke?
I definitely start to get a dull headache that increases, and I need to get away from it. You know, I can only tolerate it for a couple hours at most. And if and that means, and I'm thinking of my father, his house, he smokes in. So when I was over there just recently, you could tell that he smokes in his house, but he wasn't smoking around me, but I could only be in his house for a couple hours, most, because I could just feel my headache rising.
What about perfumes? Do those bother you?
That's a good question, especially if I'm in an elevator with someone with a very heavy, and it doesn't seem to be colognes as much as female older women's. There's a I have to find that specific scent. But it is piercing, and yes, it goes right through my nose. So
what about paint fumes or solvents?
I haven't noticed that as much, and I've been painting recently, so no.
What about like cleaning solvents, like ammonia and things like that? Does that trigger any symptoms at all?
Not that I've noticed, but no.
Okay.
Not that I've noticed.
Yeah, people who have with rhinitis are also, many of them are also sensitive to these, just not only allergic, but to these non-allergic triggers as well. What's interesting is not only can they trigger these rhinitis symptoms, these hay fever symptoms, but they can also trigger the migraines as well. So that was the first hint that maybe there might be an association when we were starting to do some of our research. But now,
that does make sense.
What would you tell a headache patient that's experiencing sinus symptoms about what they might do or how they might treat things?
Well, I definitely would say not to wait to talk to a migraine or headache specialist if they're already seeing an allergist. I didn't even think about that. I don't think it was even on my radar until I was complaining so much to my allergist about it. I didn't associate the two at all, and I don't think my allergist did either. Until I was just complaining as much. Let's see. I also would say that in addition to this, I was starting to feel like that I was kind of crazy because I was, with getting shots for allergies and taking some in Singulair and medicines for that, then seeing a pulmonary doctor for asthma, then getting sleep apnea, then seeing you. I'm like, I'm only 40, I'm a young woman that's very healthy, and I feel like I'm, declining in health. So I did feel a bit crazy, and that's what I would say is to see specialists. Don't be afraid of it. You're not crazy, especially if you're living in this area. It's very normal, and I'm definitely a case that can attest to it.
So I think that probably the take-home message is if you have what you think are sinus headaches or hay fever or rhinitis that might be triggering your migraines, that you need to treat both.
Yes.
So you need to treat the migraines with preventives, but you also need to treat the allergy or sinus to see an optimal treatment response. So I think with that, we'll close, and we'd like to thank you for your participation in this interview.
Thank you very much, Dr. Martin. I appreciate everything you're doing to kind of bring both together.
Okay, thank you.